Okay, so we'll look at another method of adjusting the lumbar spine. In the previous video we did the compressive extension method. This is more of a traction method, and it's often called the pull move with the kick. So this is going to be useful for patients in acute pain, patients that perhaps are a bit bigger than you, so you need to get a little bit more leverage. So, as with everything else, you need to make sure you've examined your patient first and you know what you found and exactly what you're going to do. You need to know your landmarks. For this we're going to look at L5, or the lumbar sacral junction. So we know if we come off the iliac crest, straight down, we are at L4, we come down, we're onto the spinous process of L5. So we need to use our fingers to grip on here. What we're actually gripping on to is the spinous process of L5, and for a little bit extra leverage, the mammillary process of L5. Now the mammillary processes are quite big. We know that the multifidus muscle attaches onto those. They're like a kidney-shaped piece of bone on the superior articular process here. So we slide our fingers on to the spinous process, and then our first finger sits on top of the mammillary process. Okay, we're going to use those to push. It's not strictly a rotary movement, it's more of a push forwards movement. We're also going to use the leg kick to do that. So make sure your patient is set up properly on the table. What we'll do, we'll bring the arm up, just rest it on the side, take a little bit of the slack out just by bringing that forwards, and then slightly down with that shoulder. That's going to rest on top. Okay, so the bottom leg is straight, top leg bent. Now what's different with this is rather than scooping down, we're scooping under. So if we bring forwards and then under, and what that does is it raises the leg here, because we're going to use the leg as a lever. Okay, so we take the slack out, not this way, but upwards. Upwards. We find our spinous process, we hook, we find the mammillary process. Okay, and from there we just roll the patient as one unit towards us. Then up comes our leg. Okay, and the leg comes right up and rests on top of the patient. Okay, so what you can see is my knee just underneath the gluteal fold there. So, brought the patient forward, you can see the leg. Make sure you've got that scoop, that's really important. Now your leg is coming up, it needs to come up a fair way, not this, but this. Okay, so you need to roll your patient, so the leg is coming up here. Okay, there's a slight bit of adduction, and the actual kick is an extension of my knee. It's not an extension of my hip. It's an extension of my knee, like that. At the same time, this lever and this lever have to connect to create the movement. Make sure you've got your contact. Come in with the leg, take the slack out and through. Okay, so have a look at video 1. This is video 2. Again, you need to know different ways of doing the same thing on different types of patients. Bearing in mind, like I said in video 1, we are practicing on young, fit, mobile patients that aren't probably in any discomfort or pain. So you need to be able to modify your approaches.